So a lot of you must have heard about new LLMs coming up that specialize in Indic language. There's Ola's Krutrim, there's the Telugu LLM Chandamama Kadalu that we had talked about previously. There's of course ChatGPT and Bard, or rather Gemini as they are calling it now. And some of you might be wondering how it's going to make a difference in your everyday life. So to answer that question, let's look at a piece of news that you may have missed last month. So around January 15, the Ministry of Science and Technology had made this announcement that the Doctor on Wheels project, which is basically a project wherein a clinic of sorts with all the medical equipment required to diagnose ill patients, will be stored inside a mobile vehicle, and that vehicle will course through the hilly terrain of Jammu and Kashmir to provide whatever medical attention is needed to people in remote areas. So under this project, they have now added an updated feature of an AI doctor. Now, what this AI doctor will do is basically it will interact with the patients in their native language. So you don't need to now wait for a doctor from the city to come into the hilly area or the remote area and interact with the patient, and vice versa. A patient, like say a pregnant woman, does not need to travel all that distance to go and interact or get the medical attention that is required. Instead, they will talk to this AI doctor who will interact with them in their native language. The doctor will then either connect the patient to a specialist, or it will carry out a medical profiling of the patient, and then provide the prescription accordingly. Now, all of this is fine on paper. There's nothing really wrong with AI being used in such a way in healthcare. But again, there are certain things that we as people having digital rights and data rights need to be careful about. So you have to, whenever you interact with any kind of AI doctor that sort of interacts in this manner, you have to ask some questions like what kind of LLM is being used by them, because that will determine which company is going to have access to your data. So for example, if it's ChatGPT, then OpenAI might have access to your health data now. And if you think that that will not happen, then what kind of companies will have access to that data? Will it all only be hospitals? Also, will the patients be told that this data is being stored, or for how long it's going to be stored, where it's going to be stored? Also, under the data protection law of India, there is a right to erasure that each user has, wherein they can see that they want the data removed. So in case of an AI doctor, how will that happen? Is there going to be a human assistant over there who can help interact with the patient and let them know about these rights that they have? How is the patient from a remote area seeing an AI doctor for the first time going to know how to interact with this doctor? And also, under which government initiative is this being done? Because MediaNama wanted some of these questions answered, but considering we don't know under which initiative it's being done, we don't really know under which department it's being handled, so we don't really know whom to ask. Now, why these questions are important is because at the end of the day, all of this is your personal health data. Health data is something that is not specifically mentioned in the data protection law, but it's something that is very important to you as a person, and therefore you need to know, you need to answer these questions to know what is going to happen to your data or how you're going to take care of this data. Despite all this, MediaNama has been constantly updating its stories about what is happening in the LLM world, in the AI world, what are the other concerns that are cropping up over time. Now, if you want to know more about or read in detail what exactly happened in Jammu and Kashmir, you can look at the story that is in the bio over here. Also, if you want to see any other stories related to LLMs and their concerns, MediaNama has also covered a lot of these stories, which again you can see in the bio. And if you want to see more explainers related to these kind of technologies, do follow MediaNama both on YouTube and on our website.